Infertility issues and right age of the conception. Infertility problem is now not seen only in women but also in men due to reckless, restless, stressful and tensed lifestyles. Hi everyone, this is Chandni Mahajan from Celestiel Energis, your life coach, trying to throw some light over this hot topic nowadays called infertility. Infertility is inability to conceive baby. It may be that one partner cannot contribute to conception or that a woman is unable to carry the pregnancy to the full term. Research finds infertility certainly causes stress, but not vice versa. In fact, even when physical stress or emotional stress does interfere with the menstrual cycle, stress-induced hormones change and are usually self-correcting and self-limiting. That means when there is fertility problem that follows stress, the stress was most likely trigger for a pre-existing medical condition or a predisposition. Women can conceive under the most stressful circumstances if there is no physiological problems. Even traumatized women, war prisoners, often get pregnant. If reproductive systems are as vulnerable to stress as many believe, the human species would have perished long ago. And that means the old advice, just relax, that you'll get pregnant, is a myth. Although most stress does not impact egg quality, it can lead to the behavior that cause fertility problems. For example, women may leave fertility treatment, harm their fertility through drugs, smoking or drinking, avoid sex, postpone childbearing, or not follow the instructions for the fertility medication. Now, if we talk about the correct age of conception or correct age for conceiving a child, it is from 21 to 35. That is the right age. In fact, in your mid-20s, it is the right age for you to conceive. So now, reducing stress is always a good idea during fertility treatment. Here are some suggestions. First, accept that you have no control over your past or future or even for your present. That means making a deal with yourself to live in the present and deal with the diagnosis. Choose to behave as if you are calm and optimistic. Your brain will signal your body that extra adrenal is not needed. Soon you will actually feel more calm and optimistic. It works. Make sure your partner supports the system and know that you are not to be blamed. Encourage partners to come to appointments to gather the real facts. Don't leave your job to reduce stress level while going through fertility treatment unless you wanted to leave anyway. Leaving is often counterproductive because any drastic change in daily life usually increases the stress level. Besides, familiar routines are usually more stress reducing than unstructured free time, and work relations can offer distraction and support that we can always learn in this lockdown period that we have to bear for 68-70 days, that this unscheduled or unstructured free time was actually getting so stressful for all of us. Now take some time out from worrying, watching and waiting, because play and laughter are the nature stress relievers. Competitive games with others, online individual games like crossword puzzles, watching comedy and watching to what you actually feel like is much more stress relieving. If you enjoy working out, go out. Exercise helps burn off frustration. You can feel more like you did before you exhausted yourself with the self-blame. Infertility causes can affect one or both the partners in general. In 1/3 of the cases, the issue is man. In another third, it is the women. And remaining cases, it is the both. No cause can be found other than these two causes. Now, if we talk about male infertility, that could be abnormal sperm production or function, problem with the delivery of sperm, overexposure to certain environmental factors such as pesticides and other chemicals and radiation, cigarette smoking, alcohol, anabolic steroids, taking medication to treat bacterial infection, high blood pressure, depression can also affect these fertility issues. Frequent exposure to heat such as saunas, hot bathtubs can raise body temperature and may affect sperm production. Damage related to cancer and its treatment, including radiation and chemotherapy. Treatment for cancer can impair sperm production, sometimes severely. If we talk about causes in female infertility, there is ovulation disorders which affect the release of eggs from the ovaries, uterine or cervical abnormalities, fallopian tube damage or blockage, endometriosis, primary ovarian insufficiency, cancer and its treatment. Certain cancers, particularly reproductive areas cancers, often impair female fertility. Both radiation and chemotherapy may affect fertility. If we talk about the risk factors, both men and female are actually at the risk. Both are equally, that I have already discussed, that both are actually the main reason. Infertility are the same for most of them. Like we can talk age. Women fertility gradually declines with the age, especially in their mid-30s. As I told you that the correct age of conception is 24, mid-20s, or everybody is nowadays career conscious, so I would suggest mid-20s. But if we talk early 20s till mid 30s is the right age. But when they sometimes women reach their, especially in mid 30s, and it drops rapidly after age of 37 because the quality of egg starts declining. Infertility in older women is likely due to lower number and quality of eggs again, and can also due to the health problem and effect of fertility. Men over age of 40 can be less fertile than the younger men. Use of tobacco, smoking tobacco or other drugs by either of the partner may reduce the likelihood of pregnancy. Smoking again reduces the possibility. Miscarriages are more frequent in women who smoke. Smoking can increase the risk of erectile dysfunction and low sperm count in men. Alcohol use, being overweight, being underweight, exercise issues. A lack of exercise contribute to obesity, which increases the risk of infertility. Less often ovulation problems may be associated with frequent strenuous intense exercise in women who are not overweight. If we talk about prevention, we need to quit smoking. If we are actually looking for fertility things, or we are looking for conceiving a baby, we actually need to quit smoking. Avoid alcohol and street drugs. Limit caffeine. Exercise moderately. Avoid extreme weight exercises, or avoid extreme head out exercises. So these are all precautions which actually one should take to get conceive, or actually to get babies. Today I just discussed, or just thought of discussing this topic just because of the reason there are n number of people, those who are coming to me with the reason, ma'am, we are not able to conceive. So what can be the reason? Definitely the reason can be your sacral chakra in women and root chakra in men. But if we talk about the health issues, so these are the major physical and health issues. If you actually wanted to get yourself aura cleaned, or you want to get your aura open, chakras opened or cleansed, you can contact me on my any of my numbers provided in the link below. So these are the things which we can actually work out for the fertility things. If any one of you want me to discuss or share any topic, please feel free to ask and leave your suggestions or ideas in the comment section below. Thank you for watching my video. If you like my video, give thumbs up and kindly subscribe my channel Celestiel Energis. Thanks once again. Have a nice day. Stay blessed. Stay safe. Goodbye.